Thanks. Hey, it's been a year and a half since many of the urgent crisis centers opened around the state. They're basically like an urgent care, but tailored to help young people struggling with their mental health. Today, there's a public hearing at the Capitol where state lawmakers are considering extending the funding for these programs. NBC Connecticut's Jennifer Joas spoke with the UCC in Hartford about the need they continue to see for this service in our state.
Since this urgent crisis center opened here in Hartford, they've helped about 800 families. They're still trying to spread the word about it, though, and secure additional funding.
It took many years, decades even, for people to start to use urgent cares on a regular basis. That's what this is doing for behavioral health. We're still building.
But the chief medical officer at the village says the need is still there, and they're doing everything they can to let families know that they can come to these urgent crisis centers and get immediate help instead of waiting at the emergency room. 50% of the families the urgent crisis centers have helped in Hartford, Waterbury, and New London say they would have gone to the ER without the UCCs.
99% of children met their treatment goal. So I think when you have outcomes like that, and we compare them to the amount of return visits that we often get to the EDs, it shows that when people know and take advantage of this, that it can be a wonderful alternative.
Representative Tammy Exum is in full support of the UCCs. The bill legislators are considering would study their effects across the state and increase the funding from $7.6 million to $8.6 million. It would also make it available through the Department of Children and Families General Fund instead of under Medicaid.
For the state to provide support for it that is not exclusively under Medicaid is really important because, again, we have so many youth that have private insurance, have no insurance, that come and seek help from our urgent crisis centers.
This bill is in the early stages, and so lawmakers will collaborate on which funding is best moving forward. Right now, families can walk in with no appointment to get help. And the village says the state funding ensures getting help isn't a financial burden for these families. The creation of these mental health programs was widely supported in the past. I reached out to two ranking Republican members of the Committee on Children, but haven't heard back yet. Jennifer Joas, NBC Connecticut News.